We are joined now by Dr. Joel Zinberg. He's a senior fellow at the Competitive Enterprise Institute, also on the former senior economic and general counsel for the Council of Economic Advisors for the Trump administration. Dr. Zinberg, welcome to the program.
Thank you for having me.
We're going to be talking about your ideas for reform of the CDC, but first give us an idea of your medical background and the Competitive Enterprise Institute and kind of their point of view.
Okay, so I practiced surgery in New York City for about 30 years, did general surgery, surgical oncology. I also have a background in law and public policy. I taught at Columbia University Law School for about 10 years on medical legal issues and policy issues that involve law and medicine. As you mentioned, I worked at the Council of Economic Advisors as a senior economist, and I was also general counsel there and was very involved in helping to formulate some of our position papers and the chapters for the economic report of the president. And currently I am at the Competitive Enterprise Institute, which is a libertarian think tank that deals with trying to remove unnecessary and harmful bureaucratic obstacles in our economy. I'm also the director of Public Health and American Well-Being at the Paragon Health Institute, which is a new health policy research center that's trying to improve health and lower costs by empowering patients and encouraging innovation.
Well, I want to show you a clip from June of this year. Dr. Rochelle Walensky was the outgoing director of the Centers for Disease Control and Prevention at that time. She defended her leadership and decision-making during the COVID-19 pandemic and testified in front of the House Oversight Subcommittee. Let's take a look.
Throughout my tenure as CDC director, I used the best available and often emerging data to inform real-time policy decisions. Rarely did we see new scientific findings that were immediately and unanimously clear and consistent. But at CDC, we have a strong commitment to acting quickly with transparency when new science gives us better ways to protect the public health needs of our most vulnerable. For example, when 2 studies were released in March of 2021 showing that we could reduce physical distancing in schools from 6 feet to 3 feet, we acted to release new updated school guidance just 4 weeks after our initial effort. Fortunately, today we know so much more about this virus than we did when it first emerged. And in 2023, we believe the darkest days of this pandemic are now part of our history. Despite important accomplishments and improvements to our public health lab capacities, expanded ability to collect and share high-quality public health data, and bolstered public health infrastructure, CDC still has more work to do, and I am deeply motivated to make improvements based on what I had seen. I launched an all-agency review, CDC Moving Forward, in April of 2022 to address the lessons learned from COVID-19, increase accountability, and improve how we deliver information to Americans. As CDC continues this internal work, we need partnership with Congress to better position CDC for success. In closing, the rate of infectious disease threats that I have seen as CDC director should be a warning to us all. As a nation, we failed to heed the lessons from previous disease outbreaks. We are once again faced with opportunity. Collectively, we should focus our work on moving the agency and public health forward. Our response to the next infectious threat relies on how we come together and have productive conversations about supporting a more prepared America.
And Dr. Zinberg, I want to get your reaction to that. Also want to remind our viewers that if you'd like to call in, you can start doing that now and ask a question or make a comment about this subject of reforming the CDC. The numbers are Republicans 202-748-8001, Democrats 202-748-8000, and Independents 202-748-8000. And we also have a line set aside for medical professionals. That number is 202-748-8003. Dr. Zinberg, what do you think of what Dr. Rochelle Walensky said?
Well, look, I don't think it's any surprise or mystery to people that the CDC had multiple failures throughout the pandemic. And Dr. Walensky, about a year ago and earlier, acknowledged all those failures. She said we were responsible for some pretty dramatic public mistakes, from data to communications, and, you know, they were well beyond that. And the real question is why? So what I did with my colleague at Paragon, Drew Key, was to set out to look at the history and organization of the CDC and look at its pandemic performance to try to figure that out. And what we found was a major problem was what's called mission creep. The CDC has grown into a diverse set of centers and programs disconnected from one another, most of which have very little to do with its primary mission, which is supposed to be combating infectious diseases and stopping communicable disease outbreaks from happening. You have programs that have very little to do with that. Some of them have very little to do with medicine at all. So you have a situation where just a small fraction of CDC resources are devoted to combating infectious disease. One estimate had it at about no more than 8%. So we really think that lack of focus on infectious disease left the CDC unprepared to combat the pandemic. And once the pandemic arrived, it impaired their effectiveness in combating it.
So really your report talks about refocusing the CDC on infectious diseases and combating that and stopping those. What else? What other specific recommendations do you have for the CDC?
Well, so what we uncovered was, and we detail in a great length during the report, is that there are multiple areas where the CDC is looking at other things far afield from its core mission. And many of those things are actually duplicated in other agencies in the government. So, for example, the CDC has one of its biggest centers is looking at chronic diseases, things like cancer, heart disease, stroke, various other neurological diseases. And these are all things that are duplicated in other agencies, particularly the National Institutes of Health, the NIH. And they're in institutes there that were established before the CDC got into those business areas. And they're very well funded, in fact, better funded in many cases than the CDC itself. So we're suggesting that you don't need this duplication. It's unnecessary. It's distracting. That we think Congress needs to go back and look carefully at what the CDC is, how it's organized, what its structure. And I mentioned that, you know, this mission creep occurred, and we think it was really aided and abetted by the lack of congressional authorization. And what I mean by that is, in our system, our constitutional system, Congress has the power of the purse, the power to spend, and they generally exercise that in a two-step process. They authorize measures that set up or extend or modify programs and agencies, and that sets out the goals of the agency. It sets out the organization and structure. And then that's followed by an appropriation, which provides the funding. And very little of the CDC is actually authorized. So what's happened is it's grown up sort of haphazardly, with things being pulled from all over the government, primarily in the executive branch, where CDC was actually created, not by Congress, but by the executive branch, as the Communicable Disease Center in 1946. And it's grown by accretion, with all sorts of things being thrown into it, which really don't belong there. So we think the Congress needs to go through the hard work of a step-by-step process, authorize the agency, put things in there that belong, take things out that don't, maybe even move some things from other places into the CDC. And it needs to also do things like setting up good guidance procedures in the CDC, similar to, for example, what the FDA has. So making sure that the guidance that CDC issues is scientifically based, that there's been an opportunity for public comment, that people know that it doesn't have binding legal authority, it's just advisory, but primarily primarily setting up to assure the public that this is scientifically based and it can be relied on. And I think that's been the great casualty of the pandemic. It's undermined public trust in the CDC, and it's undermined public trust and willingness to follow the CDC's recommendations.
Dr. Zinberg, I want to read you before we take calls, I want to read you an opinion by Dr. Lena Wen. She's a public health professor at George Washington University, and then have you respond to her comments. She says this: the debt ceiling deal recently struck by Congress and the Biden administration will reduce anticipated CDC funding by an estimated $1.3 billion, with resulting cuts to the public health workforce and programs for routine childhood immunizations. The agency's director must make the case about why this will harm the country's health, not just to Congress, but also behind the scenes to her own bosses when they determine negotiation priorities. An effective leader is one who's in lockstep with the White House publicly, but is successful in achieving wins privately. What are your views on that and the reduction in funding?
Well, look, the CDC did its, Dr. Walensky referred to this in the clip you played, they did its own review of what went wrong called Moving Forward. And unfortunately, I think they misdiagnosed the problems they had. They said they had problems in communication, and this was brought on by insufficient funding. And that's, the common bureaucratic trope. We just didn't have enough money. We need more money. And what we're proposing is, instead of blindly increasing the amount of funding, look carefully at what you need. So, yeah, it's childhood vaccinations are very important, and the CDC ought to be focused on that, but there is a whole host of things they should not be focused on that's distracting them from important initiatives like childhood vaccination. So, for example, during the pandemic, that Moving Forward report boasts that in April 2021, shortly after Dr. Walensky came into her position as CDC director, she was bringing on programs dealing with systemic racism and ensuring that health equity would be infused throughout the agency. Well, I can remind the viewers that April 2021, we were struggling to roll out the vaccine. Less than 1 in 5 people in the United States were vaccinated. That's when the CDC ought to be concentrating on vaccination, not rolling out sort of trendy things like social justice and health equity, and they shouldn't be concentrating on other things, things we detail in the report, like climate change and gun violence and things, all of which may be very important, but they really arguably don't belong in an agency that's supposed to be protecting the country from communicable diseases.
All right, let's talk to callers. We've got Ed up first, independent in Athens, Georgia. Good morning.
Hey, good morning. Yeah, I'm really curious if your guest took time to think about the impacts that Trump's decision to close the pandemic response office in the CDC had on their ability to to respond effectively. I'm also just wondering if your guest honestly believes that, 2 of the most pernicious diseases in our American society, racism and greed, are not worth studying, because in my mind, they definitely impact things like health equity. I mean, when more women of color are dying in childbirth and, people aren't able to have, healthy lives and access to health care, those seem like things that we really should be considering. And I'm just curious about how this capitalist-brained, analyst sees all of these issues. So thanks.
What do you think, Dr. Zinberg?
Well, thanks for that question. But, the reality is there's this canard that somehow a pandemic response unit was shut down, and it's usually the discussion usually centers around the National Security Council. And I can tell you, I was there at the White House during that period of time, and the folks at the National Security Council who formerly were in this response unit didn't go anywhere. They were in the unit. In fact, one of the those people approached us at the Council of Economic Advisors about doing a study dealing with vaccine innovation to combat upcoming pandemics. Now, we were looking at influenza. This was back in the summer and fall of 2019, but we issued a report dealing with vaccine innovation to combat upcoming pandemics, and we talked about how there was a need for public-private partnerships, and that's precisely what happened in Operation Warp Speed. And the end result of that is that you had a new vaccine in 10 months' time, which is an unprecedentedly short period of time to create a new vaccine for a novel disease. So there was nothing wrong in that regard to what was going on in the Trump administration, and it's just not true that there was some dismantlement of an important pandemic response unit. And your caller talks about all sorts of important priorities, and they are or may be important, and people can differ. But the point is, do they belong in an agency whose primary mission should be combating infectious disease, combating upcoming pandemics? And I would argue no, they don't, and they distracted the agency from performing these functions properly, and we all suffered as a result. And what we need to do is refocus the agency on those priorities so that when we have a next pandemic, and there will be another pandemic, I can't tell you when, I can't tell you what the organism is going to be, but there will be another new pandemic so that we're prepared to combat it.
And I just wanted to show a Reuters article about that claim about Trump firing the entire pandemic response team in 2018. That has been determined as partly false claim. It says that the Global Health Security and Biodefense Unit, responsible for pandemic preparedness, established in 2015 by Barack Obama. The unit resided under the National Security Council, and it says that in May of 2018, the team was disbanded, and its head, a top White House official in the NSC for leading the U.S. response against a pandemic, left the Trump administration. Some members of the Global Health and Security team were merged into other units within the NSC, according to Reuters. Alan is calling from East Chicago, Indiana, Democrat. Good morning.
Good morning. Thank you for having me on. Big fan of this show, and appreciate you being here. Yeah, that was the one question I had to ask, was about that pandemic preparedness and response team and the plan. Because I remember Trump was asked about that, if he got rid of him, and I remember he said, no, I didn't do it, that was John Bolton. But apparently, yes, they did shut it down, and the head left, and that was what happened to the plan. I don't know. But I also asked, is it true, because of the tax cuts that Trump put in, he had each department had to take at least a 5% cut in their budget, if not more. And with their Health and Human Services, didn't the CDC at one time have like 16 centers around the world, but they had got cut back to 10, and that one of the centers was in Wuhan, China? This was before the pandemic, obviously. And they had to shut down, which I think was probably, in hindsight, might have been a mistake. Somebody may have caught something early. I don't know. That's just speculation. And finally, I want to look at with the response. I didn't blame COVID-19. I think it was the response to COVID-19 was a problem. As Trump did come out and say, he was made aware of it in that interview he did with Woodward, but decided not to tell the American public because we couldn't handle it. We couldn't handle the truth. I said, okay. And then he called it a Democrat hoax. And so we kind of got off to a slow start with it. And he certainly mishandled it all. And then talk about the distribution. Yeah, I congratulate them for the warp speed, for the vaccination. Yes, wonderful job, fantastic. But he had no transition team, would not work with Joe Biden's team. He was mad about the election. So he didn't pass on anything to Joe Biden's people.
Okay, Alan, let's get some responses. Go ahead, Dr. Zinberg.
Well, again, going back to this question of CDC funding, the CDC was better funded during these last few years than it's been ever in its history. It got alone in 2020 about $7.5 billion of additional appropriations, which is almost doubling its budget. So it's not as if they were strapped for resources. The question is, what did they do with the resources? How did they handle that? And the fact of the matter is, if you're distracted from your primary purpose, if you're looking at other things like gun violence and systemic racism, when you're in the biggest public health crisis of the last 100 years, there's something wrong with that. I'm not just saying it's completely a lack of focus. There was certainly a level of incompetence, and there was also, unfortunately, a level of political influence. I mean, there's no question at various times the CDC seemed unwilling to look dispassionately at the scientific data on things like school reopening, and they seem to be very willing to listen to influence from teachers' unions and other interest groups about keeping schools closed, when it was pretty clear early on that the young people were not particularly susceptible to this disease. Being in school did not pose a threat, and that schools could be reopened. And the problem is, as we've detailed in another report called Freedom Wins, the CDC unfortunately abetted all the sorts of lockdown measures, which we document in that report, has had little to no influence on public health, but they had tremendous negative impact on the economy and on education. And we're unfortunately going to live with those results of kids who've fallen way behind in reading and math scores for decades to come.
All right, and Sarah is a public health professional in Decatur, Georgia. Good morning.
Good morning. Thank you. I'm just, again, live here in Decatur, Georgia, so very familiar with the work of CDC. And I think your guest, certainly there's always room for improvement. There should be a review of what was done and what could have been done better. And I think CDC has made efforts to do that. I think this refocusing on sort of getting CDC back to its roots of communicable disease, which is true, is how it started. Its history was to deal with that. And talking about other agencies could do things, but I think there's some real value in what CDC does for other conditions, other problems, taking a public health approach that is not strictly medical, that the other agencies don't do. I know the NIH is wonderful at clinical research and addressing, the basic science of health problems, but CDC and its support, really its mission is to help public health, to help the public. And I think your guest should probably mention that the majority of the funding that comes into CDC goes out the door to the states and the local health departments for them to have an impact on public health. And so I think that should be acknowledged, that it's not strictly just looking at communicable diseases, which they have and have a great history of, and a history of dealing with other important outbreaks and diseases in this country. And again, the pandemic, there were a lot of lessons to be learned, and I think they're working towards that. But I think strictly refocusing it just to infectious disease would be short-sighted and sort of not help local communities, as you were talking about, getting vaccines at the local level. CDC pays for a lot of those to go out the door, pays for the chronic disease programs that are housed in health departments and local areas that the other agencies just don't do. So before reforming it and throwing the baby out with the bathwater, I think should look more at the more recent history of CDC and the good work that CDC has done in some of those areas.
All right, Sarah, what do you think, Dr. Zinberg?
Well, that's a great question. The problem is that the CDC failed in some of its basic functions, and in particular, you talked about its relationships with state and local authorities. So early in the pandemic, for example, the CDC had a data system that was supposed to communicate with states and warn them about incoming travelers who should be looked at and potentially quarantined. They were supposed to keep state and local health authorities apprised of what's going on. That system was never really functional. It went offline completely in February 2020. And when public health authorities at the state level asked the CDC what they should do with incoming passengers, they said, just let them go. I mean, so, this notion that the CDC is informing governments of important things is true. They're supposed to, but they really did a poor job. Now, all of these other things that you refer to are important issues, but why should one of the biggest centers in the CDC be looking at chronic diseases, things like cancer, diabetes, arthritis, neurological diseases, and strokes, when you have specific institutes in the NIH that deal with those, that were established before CDC got into those areas, that have bigger budgets in those areas than CDC. And NIH, by the way, just like CDC, spends a lot of its money by spending it out the door, sending it to researchers and public health officials elsewhere. It would seem to me to make sense that maybe there's a slightly different emphasis between the two agencies, but why not put the two things together where they belong, where the experts are? Why have the CDC going into areas like gun violence and racism where it has little or no expertise, and where there are other health agencies involved, and where there are other non-health agencies involved dealing with violence and legal issues? Why have that agency looking at it when you have experts in the government, presumably in other agencies, and you are just duplicating the work there? It's great to say they're doing important work in these other areas. We want to preserve it, but not if it distracts them from what should be their core function. And I think all one need do is look at the last 3 years, and you'll see that the CDC's performance was so poor that it needs to be refocused. And this is something that Congress needs to do. It needs to do the hard work of doing this, because the agency is not going to do it on its own. Bureaucracies rarely are willing to reorganize or downsize. The CDC, about 20 years ago, after its poor performance during the anthrax scare, tried to reorganize, but it met with lots of institutional resistance, and it had to abandon that effort. And the CDC's own moving forward document has misdiagnosed what its problems are and is not really offering a blueprint for moving forward.
All right, let's talk to Jeff, is in Bayville, New York, independent. Hi, Jeff.
Hello, thank you, Mimi, and thank you, Dr. Zinberg. I'd like to point out that the World Bank published a graph taken from Johns Hopkins that compared the cumulative mortality of the United States with South Korea and their near peers regarding their age distribution and so on, to make it a apples-to-apples comparison. And the basic takeaway was that there were 5 times as many preventable deaths in the United States compared to South Korea during the entire course of the pandemic to date. And there were 18 times more deaths in the United States than South Korea during the first year of the pandemic. This informs us of a lot of what needs to be done to revamp the entire public health infrastructure. If we take a look at how South Korea accomplished this goal, we can learn what we can do to do the same. If we don't take advantage of what evidence there is to get the best outcome, we're really missing the boat and focusing on just the narrow scope of the CDC, although, of course, that's an extremely important organization, and moving the chairs around to make that more efficient. It's missing the point if we don't actually focus on what actually needs to be done and then work from that point to revamp the entire public health system so we do fare better in the next pandemic, commensurate with what South Korea was able to achieve. Thank you.
What do you think, Dr. Zinberg?
Well, look, I do think as the questioner points out, that we do need to learn from the pandemic experience. And as I mentioned, the other study we performed called Freedom Wins, we looked at we didn't look internationally, although we did talk a little bit in that study about Sweden. So, for example, Sweden was much maligned for not being willing to impose lockdown measures. Sweden kept its schools open throughout the pandemic with no masking involved. Sweden had very little in the way of closures of restaurants or public accommodations and performances and things like that. Yet Sweden did as well as most European countries. And what we really looked at in depth is what can we learn in this country based on the different approaches different states took. And what many people don't realize is that in this country, public health has always been the realm of state and local governments. You know, it's not particularly been a federal function to deal with public health. And the federal government can perform important things, and it's supposed to perform important things like providing funding, like providing data, like issuing guidelines. Those are things that the CDC is supposed to do, but did a poor job. But when we looked at the different state approaches and looked at the severity of their lockdowns as measured by an independent index maintained by Oxford University, what we found is that taking the extreme approaches of closing everything down, things like places like California and New York took, did not improve your health as compared to a place like, say, Florida, which was much more open, and while it closed things down initially, was reopening its schools much earlier than anywhere else, with no really bad health effects, but much improved economic outcomes and much improved educational outcomes. So the questioner is correct. We can learn from international comparisons. We can learn from domestic comparisons, and it's important that we do so.
All right, let's talk to Dana next in Frederick, Maryland, a Republican. Good morning.
Good morning. Yes, I have two questions. The first one, wasn't the first coronavirus that started a biological weapon used in warfare? The second question is, the vaccines, the 3 vaccines that we received, isn't there a percentage that it caused some serious medical problems for people? Thank you.
Yeah, so there, as vis-a-vis a bioweapon, I don't know that there's any proof that that's the case. Now, so if you're really talking about the class of coronaviruses, you need to go back to what's called the original SARS virus, and then there was an offshoot called MERS, same family of viruses, and that's why the virus that's involved with this COVID outbreak is called SARS-CoV-2, because it's a second version of the SARS virus, which originally broke out about 20 years ago. And those two viruses, SARS and MERS, were far more lethal than, thankfully, than SARS-CoV-2 proved to be. And I've not read anywhere that those were engineered bioweapons. Now, of course, we know we have a controversy as to where did SARS-CoV-2, the virus involved in COVID-19, come from. And there's a lot of suspicion, and I think in some cases well-founded, that it resulted from a lab leak. And it's possible that it leaked from a lab where the virus was manipulated to give it certain properties that made it more infectious. Unfortunately, we're never really going to know the answer to that, I believe, because the Chinese have destroyed a lot of data. They've been unwilling to be forthcoming with information from the Wuhan lab. But, we're seeing all kinds. We know from the structure of the virus, we know from the fact that the first people who were ill were some of the workers at that Wuhan laboratory. That is highly suggestive that this came from the Wuhan lab. I don't know whether it was, no reason to think it was a bioweapon per se, but we do have a lot of suspicion that it did come from the lab.
All right, Cincinnati, Ohio, Tanya is on the line for Democrats. Hi, Tanya.
Good morning. The first thing I'd like to say is to the hostess, I'm sorry, and that is that it is time, definitely time for you guys to do fact-checking. I know it can't be done in real time, but overnight it certainly could be. And people who called the day before, their comments can be checked. Because you sat there and read from an official document that said that the Pandemic and Communicable Disease Office that was set up by Obama was disbanded by Trump. But your guest went right on saying the same things about there was never any office like that and it didn't happen, like you didn't read anything, like you didn't say anything. And that's why people are so confused. The next thing I'd like to say is that the CDC has been politicized. We know that somebody's knocking on my door. Oh, my goodness. We know that that the whole thing was confused by Trump saying that you could use disinfectants. People didn't know what was going on. What would have happened better if the Republicans and the Democrats had been able to come over to the Democrats and to the president and actually work on this problem? They fought everything from the beginning so that people got confused. And we didn't know, they didn't know what to do, what to believe, and the whole thing got politicized. So it's time.
All right, Tanya, let's get a response. Go ahead, Doctor.
Well, I think we've touched on this issue of the pandemic office, and I've addressed that before, and I think the thing you read from Reuters addressed it. The folks who were in that office remained at the National Security Council. They remained doing their jobs. They were available and they to address the pandemic. But there's an important issue with dealing with who's in authority when we're dealing with pandemics and these national emergencies. And if there's one thing I think we learned from COVID is that there's a whole host of agencies and they're very unclear lines of authority. And this is something that we're saying in our report Congress ought to be tidying up. So, for example, you have what's called ASPR, which is a agency within HHS. It's recently been upgraded to an office within HHS, and it's supposed to deal with public health threats and pandemics and take charge. So you have that. You have the CDC. You have the FDA. You have NIH. And so, for example, Dr. Fauci was leading one of the divisions of NIH, the National Institute for Allergy and Infectious Diseases, and that was unclear who's in charge. And what I think an important takeaway from the pandemic has got to be that public policy has to be made by the public officials. It can't be simply turned over to public health officials who, they have their point of view, they have an agenda, but they are not necessarily seeing the big picture, and they have to be available to advise the president and other decision makers, but the president and those decision makers have to be the ones making the final decision, balancing the benefits and costs of taking certain public health decisions when we know they may have bad economic outcomes. We know they may have bad educational outcomes. So that's part of what I think Congress has to do. It has to clarify the lines of authority. And it's getting harder and harder because we now have a new Office of Pandemic Preparedness within the White House. We have ARPA-H, which is a new research agency for health things that goes along with the pre-existing thing called BARDA, which is supposed to be a research agency dealing with biologic threats. So we have this proliferation of agencies, all presumably addressing the same issue, but it's not clear who's in charge or who should be in charge when an emergency happens. And that's part of the refocusing effort we think Congress ought to be involved in.
All right, let's go to Tim Bob in Redding, California, a medical professional. Hello.
Good morning. Hello. Am I on?
Yes, you are. Go right ahead.
Hi. Thank you for taking the call. Mainly, you're doing a wonderful job. Good morning, doctor. I'm a registered nurse, certified emergency nurse, combat Navy medic veteran. Now I'm in nurse practitioner school, where I write a lot about in graduate school about single-payer healthcare system. I was a frontline emergency room registered nurse during the COVID pandemic. I don't know where you were, but I saw a lot of disinformation amongst my patients in the population that's mostly MAGA people politically. In fact, we had the highest infected rates in the state of California, Shasta County. I'm talking bigger than San Francisco and LA County. And I'm sure you can understand that the fostering of disinformation about the seriousness of pandemics and medicine in general added to that. With that said, I'm still in the ER, and the pandemic's not over. And also, the failures of our systemic healthcare system continues on. I continue to see disparities of our poor healthcare system, such as poorly managed chronic diseases, COPD, diabetes, diseases of despair, such as fentanyl overdoses and whatnot. I write a lot about single-payer healthcare in NP school. I'm sure you've heard of the Commonwealth study.
So Tim, we are running out of time, unfortunately. Let's get a quick response.
Well, look, I'm not sure exactly what the question is, but if the question is single-payer health care the solution? No, it's not the solution. And in fact, the leading proposal there from Senator Sanders would impose a system that's really unprecedented in the world. It would impose a system where there's no private health insurance allowed. And you know, you really can't find that elsewhere in the world. Even a place like England, where it has this much-loved National Health Service, about half the population or more has private health insurance. So I don't think that's the answer. As far as medical misinformation, that's true. There's medical information coming from all sorts of places. But you know, one thing we found is that people are actually pretty good at responding to healthcare threats, and they often will respond before government can take action. And so many of the times people are good at assessing if they're at risk. We knew early on that elderly people are at risk from COVID, and elderly people began to avoid going to public places. They began staying home. They began to stay home from going to work, all without government intervention. And government intervention, unfortunately, in much of healthcare ends up making things worse rather than better, as we documented in that Freedom Wins study.
Dr. Zinberg, I want to try to get in one more caller from a medical professional. This is in Philadelphia, Pennsylvania. Ken, good morning. Very quickly, please, Ken.
Yes, thank you very much, Doctor. Good to hear from you and your expertise. I have a few quick points and would like your quick response, I guess. On the masking and the distancing issue in the schools particularly, of course, that related to risk for the teachers more than for kid-to-kid danger. Although when a single kid came down with a multi-system vasculitis from COVID, even though it was rare, you have to admit that that is a devastating effect, and rare diseases are only rare for people who don't have them. The other key point I wanted to ask you about was the lack of a push to develop medication for COVID early on, and no concerted effort was applied to looking at different medications, even in cocktail form, a la HIV. And I think that was a great weakness in the CDC effort. I wanted your response on that. And the issue of whether there's a new pandemic on the way, I think it speaks to where this COVID-19 came from in the first place, and we need more on the Chinese research in that regard. And finally, vaccine and their risk. I think we need a concerted effort in looking at particularly cardiac adverse effects from the vaccines.
All right, that's a lot there, Ken.
Yeah, thanks for the multiple questions. I'll just try to address one thing that I think is important, is that the CDC's really failed, I thought, fundamentally in failing to conduct studies early on during the pandemic when they had the opportunity to elucidate who's at risk, what measures need to be taken, what measures will be effective, what pre-existing medications will be effective. This is what they should have been doing, but they really weren't doing. So I don't think it's an accident, for example, that CDC data collection was so haphazard and unreliable that most people in the country began to rely on the Johns Hopkins data dashboard, which was started and compiled by a graduate student from Johns Hopkins. So they were not relying on the agency that's supposed to be doing this. And much of the information we got about risks and benefits of different approaches were coming from overseas, from places like Israel, from places like Sweden, where they were studying what happens in schools. And as I mentioned, the schools were open, no masking, and there was no increase in risk to anyone in school, in particular to the teachers. There was no increase in the incidence of COVID among teachers as opposed to the general population.
Dr. Joel Zinberg, I'm afraid I'm going to have to cut it off there because we're going to lose your signal. Competitive Enterprise Institute Senior Fellow. You can find them at CEI.org. Doctor, thanks so much.
Thank you for having me.
And coming up, more of your phone calls. We will return to our question at the top of the program. What's your top news story of the week? You can call us on the lines on your screen. Republicans, 202-748-8001. Democrats, 202-748-8000. And Independents, 202-748-8002. We'll be right back.
This year, Book TV celebrates 25 years of presenting